This is Sg2 Perspectives, a conversation with Sg2 experts and industry thought leaders about the biggest trends in healthcare and what we expect that's going to mean for the future of healthcare delivery.
That idea of how do we stay relevant, it's really that balance or the combination of, one, it's relevance. It's how do we continue to diversify our portfolio, knowing that we've got ever-changing needs from a patient standpoint, but we've got ever-changing needs knowing that there's differences in cultures and generations and how they ultimately want to seek care.
Hello and welcome to Sg2 Perspectives. I'm your host, Tori Richie. Today, I am joined by familiar voices from our consulting team, Melissa Threlkeld and Ryan Hallenbeck. Thanks for joining us again.
Thank you, Tori.
Thanks for having us.
When I think about some of the recent podcast conversations centered around a specific programmatic or service line area, today I want to take more of a service line agnostic approach to the discussion. Are there common themes to the questions that clients are coming to you with as it relates to executing on strategic initiatives, perhaps defining their vision? What are some of the common things that you're hearing from folks these days?
The most common theme we're hearing today is around expansion. Expansion can look several ways, service line agnostic, including how do we expand upon existing programs or how do we expand into new programs within a service line or across service lines? How do we expand within the geography we're in today or into a new geography? Lots of organizations looking to expand outside of their current geography. How do we expand into a new footprint across the continuum of care? And how do we expand and think about partnerships as a way to expand into a new market or expand into a new service line or even further develop in a service line that they have today. There are 7 key questions that we recommend organizations ask themselves when they're considering expansion. The first of those is, what is our goal? So as we think about expansion, what are we trying to accomplish? Is this something that is financially driven? We're looking to expand to increase revenue? Or is it something that's more mission driven? We're looking to expand into an area to provide care to either a new population of patients or a different type of population of patients. The first thing is anchoring around being clear as you think about expansion, whether it's into new programs, new geographies, new footprints, new partnerships, about what are you hoping to attain and how will you measure whether you've attained that goal or not. First question to ask yourself, what is your goal?
What is that true north that you're ultimately seeking with this expansion? It's been refreshing to talk to health systems now. We're getting past the point where everybody's talking about how do I cut costs, programs, how do I even looking at my staff? I've got to grow my way to increase my financial stability. The first starting point that is, what is our true north? What is our mission overall with this potential expansion? And it's the balancing act of margin versus mission, mission versus margin. They're both important overall, but that is the first strategic question, which also feeds nicely into the second one. So as you've defined what that true north is, where do we focus? As you think about the ability of the market and what's the performance going to be like there, what are some of the hypotheses that you need to ultimately garner? And then where do we start making these strategic bets? When you're looking at a strategic bet, how do you stack your odds to ensure that will most likely be successful, knowing that it is a bet and it can go positive, it could go negative, but would love mostly to expand on where do you have that focus and what are some of those key areas that you look at when determining what that focus needs to be?
That can also be what geographies do you want to focus in? Taking a look at where's the greatest market opportunity, where's the greatest potential to grow, where's the greatest opportunity to capture more patients as you think about growth and expansion becomes important too. It starts with what is your goal? And then where do we want to focus? And then what gap are we filling? So being very clear, either from a margin or mission standpoint about how you are going to differentiate yourself from your competitor and thinking about the care continuum. Where do you have gaps today that expansion allows you to solve for across that continuum? It's about what gaps exist across the continuum that you can solve for. And then how do you also solve for differentiation within the market? How can you position yourself to be different than what your competitors look like today?
On that system of care curve, that looking at it outside the hospital, there's a lot of focus around the virtual environment. If you think about expansion of programs, that doesn't have to be a physical expansion. There could be an extension into that virtual environment. We know that those volumes are ultimately going to increase. And then as you go along that system of care curve and the acuity increases and then ultimately decreases, it's also that evaluation of, do we have to own all of these assets across that care continuum? Is there a partnership opportunity? Take the example of going into a new market that you've not been in before, assessing assessing of across that care continuum, where do we partner for things like imaging services or laboratory services? How do we help fill those gaps to create that differentiated experience overall for the patients, but also for our providers that may be going into a new location?
Even as we think about that system of care, it's also thinking about how do we bring care closer to the patient, whether that's expansion into a new market that allows you to have services so that patients don't have to travel as far, but also thinking about bringing care closer into the home for the patient. So how do we think about gaps in remote patient monitoring? What processes can we put into place to provide care closer to home or in the home for patients that also enables the patients to stay out of the hospital is really important when we think about gaps.
The other big piece I would build here too is across that care continuum becomes a staffing challenge as well. Looking at things like virtual nursing programs and remote patient monitoring, we're both working with a system that's in a very rural environment overall. They've got staffing challenges of not only the providers, whether that be a physician or a nurse practitioner, but also the clinical care team that's available. And so how do they create new solutions to expand, to grow overall, but maybe non-traditional ways of where that care is being provided, and some of those virtual environments help create that. And then leading into our fourth question, it's really around this idea of where is our center of gravity? Consideration for systems completely service line agnostic is this idea about how do we create some centers of excellence, knowing that there is a direct correlation to the volume of procedures or surgeries being done and the clinical outcome that has on patients. As you think about that center of gravity and this hub and spoke model, would love to know more, Melissa, about what health systems are asking and how do they help answer that question. What's our center of gravity?
We've talked a lot on our previous podcasts about moving away from that notion of we have to be all things to all people, starting to think about as the patients are becoming more and more acute and there's more and more pressure on the hospital because of the growing acuity of patients, it's starting to think about creating these hub centers where the highest acuity patients are taken care of, where you have the greatest number of volume leading to the highest quality procedures, but not having to do that in every institution across your system. So it's starting to think about service distribution and where do we have the best opportunity to build upon the highest quality care that we have and the greatest depth of service that we offer. And then maybe taking a pencil and drawing a circle around that and then going out a couple of layers and saying we don't necessarily have to have the same level of acuity as we go forward, but you got to be able to define that center of gravity. Where is going to be your hub with the highest acuity care? And then making sure that you've got all of the services that wrap around to take care of those patients that are needed, service line agnostic, but that you're able to take care of the complexity of those patients that you have in those hub centers, and then defining how do the other assets within your healthcare system play a role in that ecosystem that ultimately feeds that hub center. When we talk about center of gravity, what we're really asking folks to think about and define is where is going to be that highest acuity center for your organization.
Don't you think this is probably one of the most hot button issues for systems to try to solve? Because there's so much political ramifications for some of these decisions needing to be made. But for that financial sustainability that we talked about before, it's absolutely critical. But they've got to make sure that they line up the resources, that they've got the buy-in across the system. How do they compensate these other hospitals that may be impacted by some of these decisions being made? But being all things to all parties is no longer possible. And because of that, now they've got to make some strategic decisions around that service distribution and ultimately deciding where are those nexus of procedures and volumes taking place. But also critically important to that then is how do they return patients to a home community maybe after a surgery's been completed. So not necessarily all care being provided at the hub, but the most critical care being provided there and then returning that patient to a home community for additional follow-up.
And that parlays in really nicely, Ryan, to question number 5. We started with what is our goal, and then where do we focus, and then what gaps are we filling? Where is our center of gravity? And then the next question is, are we enhancing care coordination? As we think about this term systemness and starting to think about what is the interplay across the system, whether it's service distribution, service rationalization, whether it's medical group structure and incentives, really starting to think about how does a system come together and really act as a system from an incentive standpoint, but also from a coordination of care standpoint. Think about patients and about that idea of the center of gravity and having a hub center. they're likely coming in and out of your hub center. They're traveling in, traveling out as they need that higher acuity care. Really important to hardwire processes that ensure care coordination with the patient really at the center as they move throughout your system, whether it's throughout hospitals in your system or ambulatory surgical centers or physician offices or urgent care centers. There needs to be a way to be able to get the data and information for a patient into a provider's hands, but also the patient's hands as well to ensure that everyone's educated and that care seems seamless. That's really question number 5 that we build upon.
Yeah, and a devil advocate of this is we can expand, we can grow, we can go to new locations, but we've got to keep in mind that patient-centeredness of all of this, and also how is our access going to be impacted when we do grow? And do we have the ability to ensure when patients need care and they need timely care, they have access to those specialty departments, those specialty clinics? We've seen through our own Sg2 research that there's a portion of that patient population that truly is loyal. It's about 35%, but that means there's about 65% that's not loyal or has the impact of not being loyal, and about 35% of that is impacted by not having access. They're loyal to a point, and if there's no access available, then they're going to seek care elsewhere or where they have better access overall. So that patient-centeredness, measuring and being able to look at your access and ensure that you have some availability of providers is critical in that overall growth plan.
And that's really hitting on question number 6. Does this improve access? Every client that I've worked with over the last year, when I'm giving a presentation to the board, or if I'm giving a presentation to the leadership team, or if I'm giving a presentation to multiple organizations, I say, who here is not struggling with access? And there's nobody. It's like 95+% of organizations struggle with getting patients in the door in a timely manner right now. There's just more demand than there is supply in some sense. Question number 6 is, does this improve access? So we've hit on what is our goal? Where do we focus? What gap are we filling? What is our center of gravity? Are we enhancing care coordination? Does this improve access? And then maybe the last question might actually be my favorite. Are we staying relevant? So there's a lot of change happening in healthcare right now. We would argue that might be one of the most pivotal times of change in healthcare. There are a lot of new initiatives, efforts with technology, artificial intelligence, increased acuity, creating capacity issues everywhere. I mean, every organization we work with has capacity issues and is trying to work on throughput. Lots of consolidation happening, lots of definition of redistribution of services, lots of definitions of service lines, et cetera. In such a changing marketplace for healthcare, it's really important for organizations to remain relevant. And some of that is further defining your mission and how you're going to line up your strategies to support your mission. And some of it is just ensuring differentiation as well. How are you going to be different? How are you going to attract consumers and patients and physicians and staff when we're facing so many workforce shortages to come to your organization, either to work there or to be a patient there? And then once you get them, how do you retain them? What are you doing to be different that makes me as a patient want to bring myself and my family members to you for all facets of care versus being more episodic? But I'm looking for a healthcare provider who wants to take care of all of my needs. How do you maintain that relevance, and how do you speak to patients and also staff members that want to come work for you? Is a question we're asking organizations as they think about expansion.
How do we stay relevant? It's really that balance, or the combination of, one, is relevance. It's how do we continue to diversify our portfolio, knowing that we've got ever-changing needs, not only from a patient standpoint, but we've got ever-changing needs, knowing that there's differences in cultures and generations and how they ultimately want to seek care. And then it's that scalability opportunity. What we find, and it depends on the market that you're ultimately in. You've got some that are in high growth, high octane environments where they've just got population increases. Some of those locations in Texas and Florida. It's very different if you go to a state like Iowa or Kansas or Missouri, where you just don't have those population increases. That's where you've got to ensure that you make the correct bets. You've got the scalability, and sometimes you need to extend your reach farther out, maybe outside of the metropolitan hub, into what we'll call some of those outreach areas. Whereas if you're going to extend resources out to an outreach area, then how do we ensure that patient flow and migration back and forth is ultimately kept? Staying relevant builds into the very first question of what's our mission overall, and has that a margin or a financial driver, but that relevance is key to long-term success.
I love how you just tied it back to the beginning, Ryan, because in my mind, that elicits the picture of a circle. Ultimately, this is circular. It starts with asking these 7 questions, but then you're in a constant reevaluation phase. Once you get to the end, it's coming back to the beginning to see, has your goal for expansion changed? Do you have a different focus now? And how does that impact where are you focused going forward? And then have your gaps that you've filled previous gaps. So what is a new gap that you actually need to fill? Is your center of gravity still the same? Or has that changed as you continue to expand? Some of these health systems are expanding rapidly. And so your center of gravity is going to change as you expand into new geographies. We have a client last night talking about that, where they've done some acquisitions. And so their previous hubs are no longer their current hubs, because as they've done more acquisitions, more and more patients have stayed out of the hub because it's become further to travel. So they're in the process of redefining their center of gravity. And then thinking about, as you define that center of gravity, how do you coordinate care among all of the different facilities and facets of the system that you have within your ecosystem overall? How are you improving access? Hopefully you're expanding as a means to improve access. But if you're expanding into some new geographies, there may be more limited access. Continuing to look at, are we finding ways to create additional access? And then back to, are we staying relevant? And then start all over again with, what is our goal? Love it.
We built a little on this during our last podcast, and you and I both, having sat on the provider side for a number of years, we have to make sure we're answering each of these questions, and it is circular in nature. But the other thing is, we've got to make sure that we've got the structure in place to help support that growth. It's the governance boards, it's the work group structure overall, it's what we oftentimes talk about, the dyad leadership. As you start to drill into this and you can get very specific around an individual service line, it's then ultimately looking at, do we have the infrastructure to help support growth in future years, to help make some of these key strategic decisions and ones that will ultimately drive to the outcome that we're seeking.
Agree. And even one step further, it's outside of individual service lines, it's having an orchestra leader, an executive who's looking across service lines to say, where are there synergies? Where are there parallels among the service lines where we have opportunities to capitalize on growth, leverage on what we've done, a best practice in one service line into another, and really someone that just sits above. And I see an orchestra leader in my head, orchestrating all the different specialties, but making sure everything comes together in a way that's cohesive and symbiotic for the system.
I love this framework because you hit the nail on the head here. Strategic planning is in no way linear. Oftentimes we have to talk about it in that way because that's just how words work. It really is a cycle. And I think that this framework helps you visualize the continual effort that's required to be successful. I'm curious, as we've seen this evolution of strategic planning, how have then key measures of success also changed? For so long, market share and direct margin impact from a financial perspective were really what organizations were fixated most on. Has that started to change? Are we measuring new things in order to quantify the impact of some of our strategic decisions?
Yes. A lot of organizations are trying to figure out how to move from market share being the number one metric that they follow, and really a metric that defines success, into more of a share of wallet. I don't know that anybody's perfected that, but there's a lot of discussions that we've had with different clients and members around thinking about share of wallet. A lot has changed from a systems standpoint. Historically, hospitals have been incentivized based on their performance. So hospital executives were incentivized based on the growth within their individual hospital. The more you start to think about centers of gravity and hubs, you have to think like a system. So it may be that one hospital, we're going to create strategies that are going to create high octane or hyper growth in one market, but that may mean another hospital becomes more of like a feeder into that growth. And how do you create a system-wide incentive structure that rewards everyone for understanding that we each have a role in the ecosystem and that the success is a collective success, not an individual success? There's a lot of conversations that we've been having with organizations of late around thinking like that and leveraging the power of being a system and lining up your incentives in such a way that rewards everyone for being a part of and participating in that ecosystem, versus historically, sometimes systems' greatest competitors were within their own system. So it's hospital A competing against hospital B versus focusing your competitive efforts outside, they were inside. It's all about aligning incentives. And that's where we've had a ton of conversations around how do we measure success, thinking a bit internally right now as we think about how do we leverage these expansion efforts, but also how do we leverage acting as a system.
The other one I would build on is there's so much a patient is going to spend on healthcare and what's our percentage of those dollars overall. We're getting more sophisticated in being able to measure that. And yes, there is the lining up of incentives. I think the other thing that we're hearing frequently from our clients as it relates to quality. Do we have the tools necessary to measure our quality impacts? And can we make some decisions based off of quality that will ultimately really high quality drives to really high performing margins or financial sustainability? And some of the tools that we have access through our Vizient colleagues and really comparing hospital A to hospital B to hospital C helps drive that overall performance. And are we moving the quality needle, which will ultimately move some of the other metrics that we're seeking in some of the more historical market share or margin impacts overall?
Yeah, lots of questions about how do we stack up from a quality standpoint with like organizations, not just geographically like organizations, clinically like organizations, but how do we benchmark and compare not just against ourselves internally, but externally to other organizations to help us identify where there are opportunities to improve.
Melissa, Ryan, always such a treat to have you on the podcast. It's so important to hear some of the key findings and the shift in perspective that members are having in real time. So really appreciate you joining again. And this is a really elegant framework to help enable some of that strategic decision-making process. So I appreciate the insights that you shared today.
Thank you for having us.
Thanks as always, Tori.
Thanks for listening. If you like this episode, please subscribe, rate, and review us, and or follow us on Twitter and LinkedIn at Sg2 Healthcare. And if you want to talk more about innovative healthcare strategies, you can always email me at sg2perspectives@sg2.com. Finally, SG2 is a Vizient company, and there are a bunch of Vizient podcasts that you might like. You can find them at Vizient /podcasts. Have a great day.